I played soccer in college. And so I had learned to, how to eat, what to do. And I think the hardest thing was after that, you've been working out for 6 hours a day and you have a good mental health, you have people to talk to.
The way that I stay healthy is mostly that I plan something in advance and then it just pops up. Either it's a reminder on my phone or it's like a block on my calendar, or it's like a meal that I'd planned early in the week that's like healthier than what I want to eat right now. It's really just about, planning in advance, and having a phone on me all the time that can like nudge me and alert me helps me do that.
Like Melissa, I was an athlete in high school. I played volleyball, I played basketball, I was on the track team for a little bit, and just being drawn to fitness was just who I was.
So how did you learn how to take care of you and your 5 kids?
Well, my grandma raised me in South Carolina.
And tell me about your grandma. How did she know about medicine and the body?
Well, they took care of their own. We didn't go to no doctor. They took care of their own.
Why didn't they go to the doctor?
Well, down to where I am, it's a long way from the doctor. You don't have transportation there.
Yeah.
Unless you real sick or something.
Yeah.
Or hurt.
I have grandchildren, so I always like to set good examples, not only for myself, but also my family and my friends. And I'm still working, so I know in order to keep active and keep working, I have to stay healthy as well.
Well, it starts from home. So, at the end of the day, we can teach outside of home, but there's so much that we can do. But I think for me, our older generations, the older people that's here on the street, those the key components to me. And if you can get them on the ball game, now it's a catch, because you got mental health, you got substance abuse, and you got homeless, and then you got people that just don't give a damn.
A lot of people in our community have chronic health conditions, diabetes, high blood pressure, heart disease, maybe strokes. And I think sometimes people don't really understand how to prevent those things. How do you think people can get information to understand how to prevent or keep themselves healthy?
Well, I think if we can not only just pass out pamphlets and flyers, because we also have challenges of individuals that may not be able to read, and even if they could read, they may not be able to understand. So I feel that it's very important that you're here today in this particular community, which is a low-income community of underserved residents, that they can speak to you directly of someone that looks like them. And if they have any questions or concerns, you can address them.
Where do we need to put the information, and who needs to be giving out the information to make sure people understand it?
I think we need to put the information out in those designated communities that are at high risk, and we need to work collaboratively together so we can start a walk, neighborhood walk in the neighborhood, have specific classes on how to eat food, how to read food labels, how to prepare foods correctly, drinking water, what's the importance of water, of drinking water and how much water. And I feel just that everyone needs to be educated. Because we are following old traditions of our grandparents or our great-grandparents that may have used lard and not olive oil. And
Lard,
yes.
In urban places like DC, access isn't really the issue, it's engagement. We have an overabundance of primary care, but when you get out into the suburbs, we have a neighboring county, PG County, which is very spread out and in some places very isolated. So the issues around, well, it's too far, or it's too inconvenient to get to the doctor, so you just rely on home remedies, or your grandmother or someone can sort of fix you right up.
Digital can solve a lot of access problems. If access is the problem, digital can get us from sort of A to B. But if there are problems of trust, if there are problems of, not having the sense of community, or not being prepared personally, or seeking sort of care, we need to make sure that we can bridge that second step. So access is one step, but then actually getting, engagement is another step. And I think some of that can be done with like more thoughtful digital. So making sure that the outreach is, of like really understandable and really clear and really simple, and you're not using medical jargon right and left. Certainly like a big step. The last step there is, how do we build a community of health that is ready to use digital tools? So we shouldn't just, throw digital out into every community and say, great, we've done it, the rest is on you. We've got to figure out, okay, we have a last mile problem. We can get digital out into these communities, we can get access out into these communities, but how do we like make the final connection to actually get engagement? And that's like the challenge that we need to be thinking about from day one in our design.
If you are giving advice to people in your community about how to be healthy, what would you say?
Well, I tell them eat, get enough rest,
Eat what?
eat, vegetable and, food like that. Eat food, any kind of, that you like. We eat everything.
What is eating healthy to you?
Eating healthy to me is eating at least 3 square meals a day. Eating healthy is not like eating tater chips.
But tater chips taste good, right?
It tastes good. And then, carry out food.
Why do you think it's so hard for people to eat healthy?
Because you're so used to the normal life. When you live in the streets, you don't think about
But
eating.
a lot of people don't live in the streets and they still don't eat healthy. So what's going on there?
So when you look at that in the environment, it could be a lot of causes. It could be because you don't have the money. It could be because you don't have the food. And a lot of people don't have that healthy lifestyle like fast food in the house. So they go for what they know.
Yeah.
So, you're going to do to get to eat.
Yeah.
So they not going to eat healthy.
Yeah.
Yeah, they preventable. So some used to living a certain lifestyle. And no matter what you tell them, they custom. I've been smoking all this year. I ain't going to stop smoking. I've been eating pork all this year. I'm Muslim. I've been eating pork all this year. I'm not going to stop. I can't doubt that.
When I ask a general question like, well, what does it mean to be healthy? Like someone will almost always say, eat fruits and vegetables, right? And someone asked me once what an eggplant was. What do you do with this? And how do you cook it? So I think we're just on the surface when we're talking to people about wellness, and whether or not they know how to use the information or know what to do with it, I think is another matter, which is probably where we should be focusing in on, because the food literacy is also really important. How do you make a good choice? But then do you know what to do once you get it home?
So maybe it's working with getting a community food program where people come and try different foods, right? Like where you have different groups come out and you try the different vegetables and things so that you're sort of introducing it.
Is there an app that identifies food items in the store? So if you put like this QR code idea, if she were to hold the eggplant up to it, would it identify it?
Maybe we should make one.
Yeah.
Maybe
then
we
it would
should
have
make one, exactly, and then
Yeah.
make a video. with
And then
people
say,
playing
look,
games.
if you want a recipe on how you can make that eggplant.
And it's actually about people actually wanting to know and wanting to really dig in and engage in their own health. And again, the gentleman at the picnic table talked about this. People knowing what to do, but then not doing it. Like, what is that about? I mean, I have that issue. I think we all have that issue.
We all do, yeah.
I just look at my own example. I'm someone who tries everything. I mean, I've tried tap dancing, I've tried rock climbing, I will try things just to experience it and see what it's like. The things I stick with are sort of the things that bring me joy with the least amount of effort.
I love this concept of like really strategically investing in creating a habit as a way of driving sort of long-term health. Because I'm with you. And there are these streak apps where you just check in to see whether you did the thing each day you said you were going to. And once you get a streak of like 2 weeks, you're like, I can't break this. I've got to just keep going. It's got me stuck now. You could have paid me $10 a day for the checks up until then, but once I'm there, like you'd have to pay me $10 a day not to do it, right?
Yeah.
And I wonder what, I'm sure there's like whole fields of behavioral like economics based on this, but like, how do we figure out what some of those like triggers are, whether it's the competition, whether it's the streak, whether it's the habit forming, and then be able to deploy, because right now doing those things are pretty expensive. But if we could figure out the right mechanism for a particular person and sort of tease it out with tools, it could be something that scales, and it could get to that sustainability.
Well, you could do like a Pokemon, right? Like a Pokemon type health game where you're getting people to walk and you're getting them to go to the store. You know that there's doctors who do prescriptions for vegetables, right? So they actually have these community gardens, which helps with mental health, and it helps with all these other community aspects. And then the doctors go with people and say, this is a zucchini, and this is, what I mean? They actually like talk them through it, but it could be an interesting game. Walk this far, you find this, you challenge your friends. So I'm competitive. So like on those walking apps, my friends will be like, oh, I've done, 10 miles. And I'm like, well, I'm going to do 15 then. So, so maybe there's a little bit of that competition in there too.
It is possible to move them along this continuum until they get to that sort of critical point when they have the aha moment. Because I think this idea that you can incentivize someone in the beginning to do something is really compelling if you can get them to create a habit. It's the bit about the nudge, the behavioral insights stuff, because I think that's what's really missing, and trying to figure out, even for our team, how do we find somebody who is expert in this to help us as we think about developing messages and outreach. And, we also want to have a digital tool or two that we use that would incorporate this. So, because it's really about figuring out what that person, like what their button is.
And, part of the challenge here is kind of what I was talking about earlier, where it's not about what we as a health system want a patient to do. It's got to be about what they want to achieve in their lives, and then to try and make that easy. And everyone's going to have different ways of doing that. For some people, a competitive thing is great. For other people, they're like, no, I don't need to beat my friends in something. I want to be, I want to do it myself, or I want other incentives. I want rewards. I want a meal, or I want it to be about football or whatever it is. So it's about marrying the two things. It's about aligning with goals that patients have for themselves and their health, and then equipping them with the right tools and information so that they can achieve that as easily as possible. And you can get it this close, and they have to sort of take that last little step, but partially it's our job to get those sort of nodes as close to each other as we can.
The challenge we have with implementation of these things is sustainability. Because a lot of these ideas have been thought about, grants have been written for them and funded. They've even been implemented on a pilot basis or, 1 or 2 year grant. And then after that, nothing happens. And so I think part of the innovation is to figure out, how do you get these innovations to stick around